You're welcome back, and this is the Dr. Abimbola Onifade. In this video, we'll be talking about the progress forecast, and what I meant by this is just to talk about how long, to answer the question of how long does it take to reverse diabetes and any other diet-related diseases, which is our focus in this program, like hypertension, polycystic ovarian syndrome, fatty liver, and so on and so forth. Now, to answer this question, it depends on following factors, which include how long you have had the disease and how far the disease has progressed. A clue to know how far it has progressed includes the drug you are currently taking, and if you're insulin, and if you have any form of complications. I want to also know your fat deposit, because once you are able to get back into, you are getting back into normal weight, it also improves as well. So if you have a large fat deposit, sometimes it shows that you can do well, especially when you are compliant, and these fat deposits, you lose them because it helps your insulin to become sensitive. Now, the major challenge most people have is that this seems difficult to achieve, and they think they need different supplement for weight loss and all the rest. That's not what I'm talking about. I'm talking about following this guide that will give, because you want to achieve it in such a way that it will impact on your health, not that you just want a quick fix that will not achieve the impact we are talking about in this program. Then also another thing that determines how long it takes to reverse this problem also depends on how compliant you are with the program. If you're able to comply with a dietary guide, you're able to comply well with the activity guide like exercise, it's definitely going to be faster than when you don't comply and you're doing it the way you like. Now, so how long you've had the disease, for those who have had it longer, it might take a little more time than those who have the disease recently, but we'll still answer this more as we progress. So now let's look at different scenarios. And the first scenario is a pre-diabetic patient that is not on medication. That means the person is recording a blood sugar of about 100 to 125 milligram per dl, which corresponds to 5.6 to 7.0 millimole per liter. So for this particular person, this person will experience a reduction in blood sugar, fasting blood sugar for the value I mentioned before. Will experience a faster, the person gets better faster than somebody who is already on medication, because it shows that the problem had not really progressed, and this is based on the parameter, not really based on if the person is on medication or not. That is what first scenario. Then whoever is in this condition should try and bear in mind that getting a better blood sugar value faster doesn't mean you have reversed this pre-diabetic condition. So the most important thing we need to reverse is the insulin resistance, and the first focus is to ensure that your body becomes sensitive to insulin such that you get a value that is healthy. This might not quickly get into the normal values that we are aiming at, but we want to get into a value that is not so high, and then that might not necessarily need medication for such values. Most of the times, we don't treat patients, all things being equal, who have value less than 150, between 150 and below 150 with medication, all things being equal, I say again, because this is not a straight jacketed approach, but all the support you need to make this decision is already provided. So why won't you take advantage of this? So the second scenario is diabetic on one medication daily, maybe just a low dose of medication like Dowlin or Mepiril, or even if it is a high dose, but just one medication daily. So this case scenario, what happens? We either take the medication off completely, or we taper it down gradually as well, depending on the dosage that the patient is using. But in this scenario, the patient is only on one medication daily. So also the progress for this kind of patient is faster because the disease had not really progressed. Then the third scenario, which is diabetic patients on two different medications, one medication daily and another one 2 times a day. Now, you know that this person had fairly progressed more than the previous ones that you have discussed. So for this kind of a patient, you discover that the patient gets off these medications gradually. It could be, and most likely, that the one the patient is using once a day, once you have followed this program to some extent, will need to be dropped, and you just be on just one of the medication, especially the one you are going to be using 2 times a day. And depending on your peculiarity, it might be that we'll first of all have to withdraw the ones you are using 2 times a day, then you just be on once a day. But there are some parameters that need to be put into consideration to make this decision, and that is why we give adequate support in this program for patients. But just bear in mind that the first two scenario might get better quickly than the third scenario. And then the fourth, this will be the fourth scenario. I made a mistake in that slide. That's diabetic on 2 medications at high dose of one or both drugs. So you see the clause in this as well. You know that the first 3 scenarios are likely going to get better faster than this scenario. But these are just based on assumption or on statistics. Sometimes it doesn't necessarily follow like that. So for those who are on diabetic on 2 different medications at high dose of one or both drugs, what happens? Most of the times it follows the previous scenario that I discussed as well. First of all, taper one down, then we get the other one out as well. But you can be on 2 different medications, and one of it might be combined. So you might actually be on 3 medications and not 2. For instance, if you are on medication like Galvosmet contains 2 different drugs together. Then most patients on this Galvosmet could also be on another medication, maybe something like Mepiril as well. So while you are taking 2 tablets, you are actually using 3 different medications. So this might not get a faster progress than the previous scenarios we get, simply because this has progressed more. But that doesn't mean this scenario too will not get better. Then diabetic on insulin and medication. Of course, this is in varying degrees as well, because some people might be on insulin, but they are on a very high dose of insulin. So this will also be tapered down gradually. And when you look at all these scenarios, these 5 scenarios that I've described, this speaks of one thing. It speaks of the fact that you need medical support to achieve all of this, because you are not supposed to get this done on your own, so that while you are trying to resolve a problem, you are not creating another one. And that is why we have provided support for this program. You can easily, we have forms that you will need to fill. The first one is when you are starting in the first week, and the last one is at the end of the second week. When you fill these forms, it will tell us your progress, and we'll be able to get back to you and speak with you. Then after this, you will need to join the premium program, which lasts for at least 3 months. So this is because some people within the first 2 weeks will be able to get off some medication. But the program has been designed for the first 2 weeks in such that you can continue your medication and still be safe while on the program. But within the first 2 weeks, some people will get off the medication and they will be okay. Some people will get some of their medications reduced even within the first 2 weeks. Why some people will get off the medication completely, whereas some other people will start experiencing a better blood sugar control while they are on the medication. For instance, somebody who has been finding it, who has been on medication, possibly insulin, we start with a lot of them like that, or possibly 2 different medications, they might even have been on insulin, and they are still getting a high fasting blood sugar. The first improvement this person will notice is that, contrary to how high it used to be, the person starts to get a value that is better. It simply means you are getting better. So when this adjusts to some extent and we look into it, then we will be able to now determine if to withdraw it gradually, which is what actually happens. This process can last between 3 months to 1 year in some people, while in some people within 2 weeks to 1 month they are able to achieve this. And from my experience, up to 50% of the people will achieve this within 2 weeks to 1 month, even more than 50% of the people, depending on how far the disease has progressed, especially when they meet the first 4 scenarios, scenario 1, 2, 3, and the 4th one that is mistakenly recorded as 3. Yeah, so in these scenarios, especially the first 3 scenarios, you discover that within the first 1 month, the drug had been tapered off significantly, while the 3rd scenario as well, even within the first 1 month, the drug could have been tapered off significantly, but within 3 months, up to 90% of the patients would have been off their medications. Up to 90% of the patients would have been off medication, or at least be almost off all medications, while the remaining percentage within 3 to 7 months would have been able to achieve. And we have made this provision, we had made this program in such a way that it will accommodate all these differences. What you need to focus on is the fact that your health is improving, because even if that is all you can achieve, I'm sure you'll still be glad you did. But not to say that you are definitely going to be able to get this over. I used to like to say the worst case scenario you can have, let's say if all things being equal, you still do not achieve anything, the worst case scenario you can have is to get significantly better. If someone that has been using insulin, high dose of insulin, and 2 high dose of other medication, end up using just 1 drug daily, as that person gets significantly better, of course the person had gotten significantly better. If you have the worst case scenario, this is what it should be. But I can comfortably say to you that if all things being equal, you are going to achieve this remarkable result of being off medication completely. Now, understand that I use diabetes as an example because it is one typical example where patients are on medication. Other examples could also be hypertension, medication for cholesterol, and the rest. So this is also adaptable to your situation. You get off medications gradually, and it must be with the support of a doctor, either your doctor, or you choose the support that will provide for you. So that's it on the progress forecast. You need to understand that this is not what just happened suddenly, and this is not just a quick fix. This is a change in lifestyle that helps you to achieve it. And if you are the type that wants to have a definite answer and say, how will this thing be? I want to say within the first 1 month, you will see significant improvement in your condition. And within 3 months to 6 months, you would have been off most of your medications and insulin if you are not off all. Last thing I need to say about this is you should realize that when this, in regards to diabetes, this talks about type 2 diabetes and not type 1 diabetes. Type 1 diabetes can also follow this program, but type 1 diabetes will need to be compliant with insulin administration, because the problem in type 1 diabetes is different from that in type 2 diabetes. So when a type 1 diabetic patient follows what we're discussing in this program, the patient will also see remarkable improvement, but the disease is not going to be reversed, because in type 1 diabetes, insulin is not being produced at all. So the insulin must be supplemented, and the patient will keep on getting better. So if the problem is hypertension, just bear in mind as well, the scenarios follow, you can adapt it to your own scenario as well, and you can also achieve it. But after the second week for the premium program, we actually separate diabetes, hypertension, and some of these category into their own peculiarities, because there are some peculiar actions to take based on some of these diseases that is not general, but it is okay to start together. I want to thank you for taking out time to listening to this video. In this video, we have learned on the progress forecast and what you should expect in terms of reversing these diseases that are dietary related. I'll see you in the next lesson. Thank you very much.